It's the 7-Minute Drill, a fast-paced and fun conversation about common orthopedic topics and solutions with Dr. John Urse. Brought to you by
Ted's Authentic Greek Salad Dressing and Marinade. It's healthy, gluten-free, and delicious. You can find Ted's in Dayton, Ohio at Dots Markets. That's Ted's Authentic Greek Dressing and Marinade. Thanks, Ted.
We would also like to thank
Stifel's GWR Group combines more than 65 years of experience helping high net worth clients consolidate, coordinate, and simplify their wealth planning strategies. The group has access to a full suite of resources to serve all of your financial needs. Email gwrgroup at stifel.com or call 937-353-2863 to speak to Guy, Brad, or Jeff Richardson. Stifel, Nicholas & Company, Incorporated.
Hello, Dr. John. We're back with another episode of the Bone and Joint Playbook with Dr. John Urse.
Well, thanks, Terry. How are we doing today?
We are getting hoarse. I'm getting a cold.
Maybe I'll do most of the talking.
Yeah, you normally do. They don't want to hear my advice. So we're going to talk today about a thing called hip scopes. And I have no idea what that is, but you're going to tell us. But before we do that, why don't you thank our sponsors?
Yeah, we have two great sponsors, Ted's Authentic Greek Salad Dressing.
Yep.
So if you look up tedsalladdressing.com, you'll get a gluten-free, dairy-free, sugar-free marinade and great salad dressing. Even if you don't know how to cook, put this on your food. You'll look like a hero.
I'm doing it tonight, by the way.
And the second is the Stifel GWR Group. They're financial advisors, Guy, Brad, and Jeff Richardson. There's a website on your screen here. You'll be able to contact them if you want some great financial advice.
All right. Those great folks. So thanks for being our sponsor. But today we're talking about something called hip scope. I have no idea what this is. What is a hip scope?
Well, the topic's really, can a hip scope help?
Oh,
and
well, all right.
What is a hip scope? Let me ask you this. If our job as healthcare providers is to get you to age 90 with your body parts,
right,
we can't replace every joint with a new knee, a new hip, a new shoulder, a new ankle, because, we don't replace every car when it goes into the shop, right? You just fix it or tune it up. So much like we look in a shoulder with a light or a knee, called a knee scope or a shoulder scope, we can look into a hip using small incisions. It's called minimally invasive surgery.
How big? Give me an idea how big the incision is.
Like enough to fit a pen in. Like,
Okay.
One stitch. It's enough to, you have to get your instruments in to do the work.
I can't believe that's so small.
Well, let's say you have a rock in your shoe and you say, well, I could just keep walking with this rock, or I could take my shoe off and shake it out. Well, if you had a loose piece floating around in your hip that was catching or rubbing or restricting movement, you would say, am I going to open up my hip and shake it out of there? Or could I look in with a light and take a grasper and just pull it out? Well, you're going to feel a lot better. There's a lot of other things that make hips hurt. So when we talk about a hip scope, we're talking about a minimally invasive procedure to look in a joint with a light.
Right.
And we have to, the reason they're not commonly heard about is that they're not done by many doctors. You have to actually put the foot in a boot, like a ski boot. And much like the Princess Bride, when they have them on the rack, you have to pull the hip part way out to get instruments in that would get into the hip joint. Which
Am I asleep?
You are way asleep, yes.
Oh,
You need
gosh.
to be, we call it a bop on the head. We want your muscles relaxed because we have to pull the hip part way out with what's called traction. So it's a little medieval, and a lot of surgeons don't do this surgery. But there are plenty of hip problems. And the way to think about, do I have a hip problem, is to say, what is my issue? Am I having trouble tying my shoes? Am I having trouble getting in and out of a car, getting out of bed? Is it my groin? Is it the side of my hip? Is it my butt? We talked about sciatic nerve pain causing butt pain, but a hip problem can. Your labrum is a gasket around the hip socket. The hip is like a ball and socket, only it's a deep socket, much more contained than we talked about shoulders that are shallow, and the shoulder kind of pops in and out of place sometimes. Hips don't pop out unless they're, fall out of a tree and you've got an artificial hip that what's called dislocates. It's unusual. So a hip problem will be best thought of as saying, am I having pain? Am I having restricted movement? Am I having trouble walking on it, or just moving it, reaching my socks and shoes, getting out of a car? Then the question is, what happened? Did I have trauma? Has it always been this way? Have I been playing sports? Have I been running too much? Do I have a reason my hip isn't shaped right? There are shallow hip sockets. There are bone spurs called bumps, like a bunion on your foot is a bump. So if you have a square peg and a round socket, it's what's called a mismatch, and that causes the hip to catch or impinge. They call it hip impingement, and impingement just means something's rubbing against something. So the poor labrum is in between the ball and socket. It gets pinched. Sometimes it tears, much like moss on a tree branch. It hangs down in the hip. It catches when you move the leg up and down. Looking with a light, you can smooth that over and remove it. Or you can repair it, a scope. Okay, so we look in with a light. We have a camera on it. It shows us the ball and socket of the hip, and it lets us address what's wrong. Is there a loose piece? We take it out. Is there a bump? We need to smooth or shave it down. So you want to make a round ball in a round socket. Otherwise, over time, we talked about a mismatch. That square peg and a round socket can lead to arthritis at a younger age. They call it the silent killer of the hip, and that's why. In our American football, we have a draft where we pick players to play on teams. Well, they have doctors checking those players for hip problems, and they do an MRI or they do an exam, and they find out, hey, this guy's got a painful hip. He may not be the guy you want to spend $4 million on with your first draft pick. So it's big business to recognize problems before you may have to deal with them. Some of them are things that the player doesn't know about, and certainly the people on the football teams don't know about before they draft them. So there's some quizzes you give them to see how smart they are, but there's also some examining you do to make sure that hip isn't the problem.
So let me ask a real basic question about the hip scope process. You put me out, you cut a small incision somewhere. How do you know how to drive the little? And by the way, how does the thing steer itself? Because
your hands control where instruments go. Everything goes in first with a needle into the correct place. We have X-ray in the room to guide where we're going. Yeah, we're avoiding your arteries and nerves. You have to trust your doctor knows how to do that. I teach some of the hip arthroscopy labs that people come to. So people that do a lot of hip scopes have, I think, a working knowledge of how to do them safely. But there is still an element of getting in where you have to be and then doing what you need to do in there to fix the problem. Yeah, that's what it'd be like looking at a gallbladder with a belly surgeon and saying, well, I don't know how to take it out. I can see it's really, really inflamed. Well, you have to do both. You have to be able to get to it and then remove it safely or tie off the artery to it or whatever you do. So I think what I try to tell people is think of your hip in quadrants. There's a front, and things in the front of the hip can cause pain. Yeah. There's side pain, what's called lateral. There's your posterior, which is the back. And then the front or the groin can be a hernia. It could be, you've heard of sports hernias. That's a whole nother topic. People who lift and wear a truss, they get a weakness in what's called the abdominal wall where it's not even in the hip, it's outside the hip. So a good healthcare provider will examine your hip. They'll take x-rays. They'll see, is there arthritis? Is there a bone spur? Is the hip shaped in an unusual way? Where is your pain? Is it the nerve going down the leg, or is it really confined to the hip? So obviously a good examination. Then sometimes we use an ultrasound to put a shot into the hip and say, is that where your pain is? And you go, my butt pain went away when you put a shot in the front. Well, guess what? Your butt pain's probably coming from the hip, or can be. And frequently, hips can make the back hurt. Yeah. So when you have a hip and a back problem, I tell people always check the hip first because it's usually an easier thing to fix than a back. We've talked about, back surgery and what that involves sometimes. So we don't want to chase that until we're sure it's not coming from another place. That's called a referred pain pattern.
You see enough patients and you've done this long enough and you've trained people on this. Somebody comes in and explains what's going on. Do you have in the back of your mind have a feel? I know what this is, but I got to prove it.
Absolutely. And a lot of these people have been to other doctors. They've been to other providers. They've been told it's their back. They've been told it's their nerve. They've been told it's a hip bursa. We did a podcast called, Are You Sure It's Hip Bursitis? Maybe Not.
Yeah.
And we talked about the glute tendons, which are on the outside that lift your leg, like the rotator lifts your arm.
Yeah.
So that could not even be, it may not even be in the joint. It may be in the muscle that lifts your leg, like a rope that lifts an awning. You may have a hamstring injury. You may have been water skiing. The engine stopped and then it started. You felt a pop in your butt. Now you can't even sit because you've torn one of the sitting bone muscles called your hamstring off your sitting bone. Well, we can fix that through a hip scope. So there are things in the back, side, and front that a scope can help based on what the problem is. So we then, with an index of suspicion, say, hey, let's see where your pain is, but let's also be sure the imaging study shows that's what your problem is, and it matches your symptoms. We talked about somebody with right leg pain and numbness who has a ruptured disc on the left side on their MRI. Well, that doesn't match. Doesn't make sense. So forget the MRI. It doesn't match the patient's symptoms. Patients have to have all the things. You want to try to get things better without surgery. You want to try an injection, try therapy, give it time. Well, then if it isn't working, then we talk about options of a scope to look in with a light, as long as there's not a lot of arthritis. If you have a bad hip from arthritis, then moving the leg and the stiffness is just from the bone-on-bone rubbing. You just need a new hip. Then we talk about that instead of a scope. A scope is not a procedure for terrible arthritis because we can't put new cartilage in your knee or hip or shoulder, but we'd like to avoid a joint replacement if it's less than that, which is what a scope can offer people, a way to look in a joint with a light and fix a problem and get your recovery to be quicker. Because now, instead of opening up the hip with a big incision, putting you in the hospital 3 days, crutches 3 months, we do all that through little holes. It's minimally invasive, but the recovery's quicker. We still have healing to do. You still have some time before returning to activities. And therefore, that's very, I guess, injury specific.
So 2 questions I have. How long does a hip scope take?
They take about an hour, hour and a half.
Hour and a half, so I'm out for an hour and a half.
Usually, yeah.
2, if you go in there with a hip scope and you look around with your steering the little thing and you see the camera says, oh, I see what the problem is and I can't fix it with a hip scope, you know at that point in time to pull it out and say, listen, buddy, I got good and bad news for you.
Yeah, that's pretty unusual. There are times where the labrum isn't fixed. It's like hanging, we talked about moss on a tree branch.
Yeah.
Sometimes when you shave that, though, and clean it, as long as there's not a lot of arthritis, 90% of people are doing great for 10 years. So
Really?
even though you don't have a labrum there, and then sometimes you have to actually put in a new graft, much like we talked about ACL ligaments in the knee, where that ropey thing between the bones in the knee tears. Well, then you just need a new ligament. We put a thing called a graft, and we do that in the hip sometimes when there's no seal. The labrum is a seal that keeps the ball in socket in a suction situation.
But I'm still fascinated by the idea. You got a small incision, you got multiple tools going in with me, you got a little camera with a light, and then
and that's on a TV screen, so everybody can see.
Yeah, but you got little tiny things going into me, and then there's something that's going to let you cut away stuff.
Oh, sure. They have little things called shavers, and then they have bone things called burrs, and the burrs remove spurs, like harder things.
Yeah.
You know, it's like a diamond chisel. I mean, if it's harder bone, you don't want to hit it with a paintbrush, right? So you need something like a burr has a cutting edge, and it removes that. Like, think of a bunion in the. I always tell people a bunion is like a bump in your foot, where it looks like a bony prominence. So if that bump is banging against your hip when you bend it up, we smooth that over with a bony thing called a burr, and that trims that bone to a smooth surface. That is what protects or saves the hip, and that's called hip preservation. So when we talked about getting age 90, if you've got a square peg and a round socket and you're 30 years old, if you don't reshape your hip and don't fix your labrum, you're getting a new hip at age 40, which is really young. Now you're wondering, how long is that going to last? Well, we don't want to do that hip replacement at 40. We talked about a third of hips are being done, replacement hips are being done in people under 55 now. That's a lot. And that's because there are a lot of mismatches in the joint where athletes just tough it out. They don't really get anybody to check it. They keep playing through the pain, or they don't have a lot of pain. So I think you're always better off knowing what's wrong and then getting the right advice for what to do about it.
So last question I have for you, and you tell me if I've left anything off, is you say a lot of docs don't do this.
Over 95% of docs don't do it.
But why not? Sounds like this is like the smart thing to do.
It's not an easy thing to do. It's a very, as you mentioned, it's not just a deep joint, but it requires traction. You have to pull the hip part way out.
Right.
Longer instruments than it, like the knee's right next to the skin, so the hip is deeper in. There are most doctors who get trained in even sports medicine will gravitate. There's so many shoulder and knee problems, ankle problems, elbow problems. Those joints get all the attention. Hips are, I call them redheaded stepchild problems because they just get ignored because the joint surgeons want to replace your hip and the sports guys don't even want to look at your hip. They want to look at your knee and your shoulder, and they're not really sure what's going on. So hip problems actually stay around longer in most people until they get to somebody who does enough of them and says, hey, has anybody ever put a shot in your hip in here, not out where you feel the pain? That's not where the problem is most of the time.
So if let me make sure I got this right. If you could resolve a lot of problems with a hip scope and people aren't finding a doctor who can do a hip scope, are they going the long way around and the hard way around to solve a problem that could have been done so much simpler?
Yeah, and you need to find your Wizard of Oz in your area. Okay, if you ask enough people, they'll say, who does hip scopes? There's somebody somewhere. Now, I mean, there were no hip scopes before the year 2000. We didn't have the instruments. We didn't have the long enough, what are called switching sticks and instrumentation. We didn't understand much of the dynamics of the hip. And it's evolved in 25 years to really be an entire subspecialty of medicine. But again, there's enough people now doing them where if you're in Frankfurt, Germany, if you ask 4 people,
Frankfurt, Germany again.
There you go. But if you ask 4 people to give you 3 names of people who take care of hips, 2 or 3 names are going to come up on everybody's list.
Right.
Start with that. And if they're not in your area, if you're in rural Ohio, you probably don't have anybody doing hip scopes. So you need to ask your doctor. He probably has sent somebody somewhere at some point to see somebody at a big center that can do that. And then you can Google it. You can say, best hip arthroscopy guys in my area.
I didn't know till the day, right? I didn't know till we sat down to do this, that this is something different. This isn't something common. And if you don't know to ask, you just let the guy do the old-fashioned way of doing it.
These people get to us eventually. They get to the doctors who take care of these problems because they're not getting better with their other doctors. And so they finally get to us. I mean, we tell people if you have a meniscus tear in your knee, somebody's probably going to fix it within 6 weeks. I mean, it catches and hurts when you bend it. It's an easy procedure by most doctors. Yeah. Everybody does knee scopes. Hips are different. They're just they're a different animal. They have different pain presentations. They act differently. They aren't classically. A classic example would be groin pain, right where the hip bends. Worse when you twist the leg, and you have to have the absence of arthritis. So remember the A word, arthritis, bad arthritis is not the thing you do a hip scope for.
Okay.
And if nothing else, just be sure you don't want to go in and say, oh, it's really bad in there, you're going to need a new hip. Well, didn't my MRI or X-ray show that? Why are we wasting money on that if the hip is already kind of crappy? Let's just talk about how to either replace it or live with a crappy hip, but don't scope a lousy joint. We don't do that with bad, like bone-on-bone knees, we rarely scope. Okay, a scope is a time-buying procedure to take out a loose piece, a mechanical problem. It's a way to clean out a joint. We talked about taking the car in for a tune-up. It's meant to get you down the road before you need a new replacement.
So before you could do a hip scope, what was your option for fixing that problem? Opening them up?
Well, yeah, and that was really fraught with neglect. There were very few people that wanted to open up your hip to look in and see what's wrong. I mean, it just was. It's a big surgery to open a hip up. You're going through muscles in the front, back, or side.
Yeah.
I mean, there was very little being done in the world of hip arthroscopy. I mean, the first one on one of our pro football players was in the mid 90s. So that was the first hip arthroscopy. It's like taking rocks out of your shoe and saying, are you going to walk better? Well, the guy did great with the surgery because he had little holes, fast recovery, took the stuff out of his hip like a bunch of marbles. And those things have now really become more mainstream. We do more things through the scope. We fix hamstrings, which are in the sitting bone. We do the glute muscles on the outside. We do the things in the joint that are the labrum tears or the loose pieces or the inflammation. So a hip scope is a great tool, just like a knee scope would be for a knee, or a shoulder scope for a shoulder. We don't open up your shoulder to do a rotator cuff in most cases. We can fix that through the scope. We talked a little bit about.
Are you in and out same day?
Oh, sure.
With a hip scope?
Oh, yeah.
You're in and out same day?
Oh, yeah. These people are on a stationary bike the night of surgery, and they're going. Now, they need a walker or crutches. If you fix the labrum or repair things, you're half the weight on that. Sometimes we wear a lightweight brace to protect a glute repair or a labrum repair. So your doctor will tell you those things when they talk to you about your problem and the options for it.
Okay. Anything I should have asked you?
It's a big topic, and I just think don't be in despair over hip pain that's either on the side, the front, or the back that nobody can find. Somebody can diagnose you with, if you go to enough healthcare providers who see those problems.
But it sounds like they need to be saying, can you do scope? Are you able to? If they say
you need
no,
to find. Well, no, but they need to send you to somebody who can.
Who's they?
Your healthcare, your family doctor, your chiropractor, your internal medicine doctor, your physical therapist may be seeing you and saying, have they done an MRI of your hip? Start with that. It'll say, gosh, you've got a torn labrum in your hip with a bone spur.
Okay.
And then once they see that, they're going to say, we're going to send you to a hip person. And then that person may recommend a hip scope.
What if they don't do hip scopes? Are they going to go do
They will send you to, most groups, like our group has 2 or 3 guys that do them. So, we have a 24-person group. So most groups have one person at least that does hip scopes. And if they don't, they come to us from some other group. I get referrals from other orthopedic surgeons that aren't in my practice.
So the doctor's not going to take the old-fashioned way of doing it. He knows there's an easier.
Oh yeah, they don't want to mess with those.
Okay.
Yeah, it's like I don't do everything, and I don't do spine surgery. So I would see your spine, say you got a ruptured disc. Yeah. I'm going to send you to Dr. Patel or one of the spine doctors and say this is the person who is an expert in that area. Your doctors can't do everything, right? You have heart doctors, you have spine doctors, you have hip doctors, you have.
We think you're all-knowing and all.
Well, it's the skilled surgeon who knows when not to operate. So you stay in your lane, you do what you do well, and you look at how your patients do. And if they're doing well, keep doing what you're doing, right? Well,
in that case, let's land this one on hip scopes. I found this one fascinating, to be honest. I never knew any of this stuff, so this is great. And if they want to get a hold of you, how do they do that?
drjohnurse.com will get you on my website. We also have oadoctors.com. That's all our offices in the Southwest Ohio area. It'll show you all our other physicians. Some of them also do hip arthroscopy. So I think you can reach us any way that's convenient for you, or look in your area for somebody who does that type of arthroscopy.
Just don't call me if you want a hip scope, because I'll open it with a flashlight, shine it in there. All right. Hey, folks, thanks for joining us here on the Bone and Joint Playbook with Dr. John Urse. We'll see you all again real soon. Thanks.